Carpal tunnel syndrome is very common. It's probably the most common thing a hand surgeon sees. The thing with carpal tunnel syndrome is a lot of people get diagnosed with carpal tunnel syndrome that don't really have it. So it's very important that if you have hand pain, numbness, or tingling, that you see a qualified hand surgeon and make sure you get the right diagnosis. Once we get the diagnosis of carpal tunnel syndrome, treatment is geared to trying to take pressure off of the median nerve in the carpal tunnel. Initially, we try to do that conservatively. And the way we do that is with steroid injections into the carpal tunnel, which decreases the swelling around the nerve and takes the pressure off that way. We also place the patients in wrist splints that hold their wrist in a neutral position, particularly at night, because nighttime seems to be when the symptoms are worse. And if we can release the pressure on the nerve in that way, the patients can get significant improvement without having to have the surgery. There are many different kinds of surgery for carpal tunnel syndrome. The minimally invasive techniques serve to go through very small incisions and then cut the ligament that sits on top of the nerve. And by cutting that ligament, the ligament splays apart and takes the pressure off the nerve that way. And that's a permanent fix. The incisions we make are very, very small. They're in the base of the palm and only about 1 centimeter. We only need 1 incision to do our version of a carpal tunnel release. This is comparable to any minimally invasive or endoscopic procedure out there. We're able to go through this very small incision back to the carpal tunnel and release the ligament that's squashing the median nerve. It only requires a few stitches to close, and patients recover very, very quickly with minimal scarring. All of the minimally invasive techniques and endoscopic techniques have very similar results as far as pain, post-op recovery, and patient satisfaction. Now, it doesn't recover right away. So to have some numbness and tingling after surgery is actually normal because the nerve is regenerating itself. And in severe cases, it can take 6 months to a year before you know what your final outcome is going to be. However, that painful burning numbness that patients typically feel usually gets better within a few weeks or sooner even.